Good morning. My name is Julie Smith, and I'm the Executive Director of the Identity Defined Security Alliance. Thanks for joining our webinar today, presented by IDSA member Remediant, an identity-centric approach to harden a COVID-19 critical business. During the discussion today, if you have questions for the presenters, please submit them through the Q&A chat window. Before I turn it over to our presenters today, I just wanted to provide a quick commercial for the Identity Defined Security Alliance. The IDSA is a nonprofit organization that facilitates community collaboration to help organizations reduce risk by providing education, best practices, and resources to implement identity-centric security. Our membership is comprised of leading identity and security vendors, in addition to our customer advisory board members who provide guidance on our mission and represent the practitioner community. We deliver on our mission through cross-vendor collaboration, thought leadership through research, our blog, which is populated by our members, and educational webinars like today. Our identity-centric security framework, which is a vendor-agnostic best practices, security outcomes, and implementation approaches, and we just published several new security outcomes today. Customer implementation stories so that you can learn from your peers and how they're implementing identity-centric security and the lessons they've learned, similar to what George will talk about today. And lastly, virtual community for sharing experiences in validation, which you'll find on our website, which I encourage you to visit for more information. Today's webinar, as I mentioned, is presented by Remediant. Our speakers are George Irungu and Paul Lanzi. George is the Chief Information Security Officer at Summa Health, an integrated healthcare delivery system in Northeast Ohio. Prior to his current role, George was the Chief Information Security Officer at Driscoll Health System, overseeing a security program covering a children's hospital, health plan, and remote clinics spread across South Texas. George also spent a significant amount of his career in the oil and gas industry with stints at ExxonMobil and Halliburton Energy Services. He is a certified information security manager and holds a master's in technology management with emphasis on cybersecurity from Columbia University in New York. George, thanks for being here today.
Thank you, Julie.
Paul is a member of our technical working group at IDSA and the co-founder and COO of Remediant. Remediant is a leading provider of precision privilege access management based in San Francisco. They bring an identity-centric approach to stopping ransomware by removing the 24/7 administrator access from endpoints. Remediant is extraordinarily fast and easy to deploy due to its agentless architecture, and they're deployed across large global enterprises like Lockheed Martin. So with that, Paul, I'll turn it over to you for the discussion.
All right, thanks, Julie. And thank you so much, George. I want to extend my deep appreciation and thanks to you, not just for making the time for me today to have this conversation, but for the great work that you're doing for the 500,000 residents of Summit County and Akron and surrounding areas. They are enormously dependent upon the organization that you serve, and I know that they would extend their thanks as well. And by the way, everyone, George is hiring. This guy right here is one of the best CISOs I've ever met. And if you live in Akron or you're interested in a position on his team, you should check out the Summa Health website. It would be a delight to get to work for George, and anyone interested should go check that out as well. And then just to reiterate one thing that Julie mentioned before, if you have questions for us, please put them into the chat. I would love to send those questions George's way. Thank you so much for being here, George.
Thank you, Paul. I'm glad to be here.
All right, great. You know, I have a couple of questions for you. The first one is about COVID-19. Go figure. I'm sure that hasn't been front of mind for you at all this year.
Exactly.
You know, for a lot of us, actually, COVID-19 kind of came on fairly suddenly. It went from a minor story in the news to being what it is now, which is a global health emergency. Really, in your experience, at what point did you realize there were going to be special security implications for the business that you're in that came out of the COVID-19 crisis?
Okay, yeah, good question, Paul. We saw a shift in the attack vectors. Spear phishing related to COVID-19 crisis themes were up. Brute force attack attempts all of a sudden was significantly up. And then we started seeing all these new domain names with COVID-19 related titles popping everywhere. However, and I think most pointedly, were the attack attempts on the teleworking infrastructure itself, whether we're talking about the collaboration systems or the VPN infrastructure. So the shift in interest by bad actors from the traditional corporate environment to remote work platforms to us signified that we were in a new phase security-wise due to COVID-19.
Got it. So it was really where the attackers started changing their tactics. That's when it became clear that you were going to have to change your tactics as well, I guess.
Mm-hmm.
Yeah, the inevitable cat and mouse game. So makes sense. We're having an identity-centric security conversation today. It's something I'm very passionate about, believing that identity really is the right way to think about security in a lot of different aspects. And I'm really kind of curious from your perspective about employee identities, right? So the workers at Summa Health, and what was their experience? You mentioned that the attackers were starting to take on some of the collaboration and remote work technologies, but from an employee perspective, how did their experience evolve from pre-pandemic to now during the pandemic?
Yeah. So as a leader, I was more concerned with the human aspect of this. How is the remote working environment for the employee? Is it ideal, and is it complementary to what, as an organization, we were asking them and expecting them to do in terms of work? So simple things like ergonomics. Did they have the right equipment? If you're talking about a keyboard or maybe a dual monitor. And then once you answer that question, it moves on to the next stage of how quickly and efficiently can they access and in a secure manner the resources and application that they need. And the reason for that is, as we all know, people will always find quicker and efficient means of accessing what they need if the process in place is too onerous. And then as time went on, as this progressed, you now start worrying about the burnout, right? These people are isolated. They don't get to see their team members. They're working maybe from home offices and so on. That home time, office time becomes very blurred. The burnout factor became of concern. And so to me, it just was not the technical and security aspect, but also the human element. And to your question, as much as possible, the plan was to make sure the employees had the same experience working remotely as they did in the office.
Which I imagine was extremely tricky given the kind of data that a lot of those employees are handling. I mean, not just the ones that are patient facing, right? But even the back office employees that are handling sensitive information. How did you kind of create a good experience for them?
It was just so user awareness, making sure that we're all, again, on the same page when it comes to some of the best practices and so forth. There's some applications, some resources, which maybe in the past we wouldn't have granted access remotely, but for them to be able to do their job, we had to do so. So really, it was a very collaborative effort, and then also just putting ourselves in the situation just to make sure that they get to what they need and at the appropriate time.
Yeah, George, I mean, this is why I love talking with you, George. There are so many CISOs that should take everything you just said about putting employee productivity at the front of the line, right? Thinking about the employee experience. I mean, it is so rare for me to talk to security people, and the first thing on their mind is the ergonomics for the employees in the company sufficient for them to be able to do their job well and safely, right? So George, I mean, I'm an open fan of yours, and it's for reasons exactly like that. The lens you use to look at the business through, I think, is exactly the right one, and I wish more information security leaders would look at it through that lens. So, all right, a mutual appreciation fest over for now, but I just wanted to remark on that one.
Okay.
I'm curious, you talked a little bit about how you and your team helped to, make that employee experience positive. I'm curious, what did the vendors do? Or were you able to count on vendors, InfoSec vendors, to help you with your response?
Oh, certainly. And I think a big reason for this was due to our approach when it comes to vendors and anyone we do business with. We consider them to be our partner, really an extension of the team, if you want to call it. And as such, they do understand our roadmap. We've shared some of the current initiatives we have in place. They know our areas of gaps and so forth. And so it was really a case of, hey, I know you have this many licenses. We're going to extend to XYZ number, and maybe further down the road or in the next renewal date, we'll do a true up. In addition to that, there were discounts which were offered to close gaps in some of the areas maybe we may have had when it came to remote work. And then not to mention the constant, the sharing of information on best practices, the thread feeds they provided, and so on. So overall, the effort we had put in identifying and then also working with the right partners paid off significantly for us.
Yeah, that's great. And maybe some social connections as well, right? Before we started the webinar, you and I were just talking about the importance of the sort of the CISO social network. And maybe you could just remark on that for a moment.
Well, yes, certainly. I mean, when you're going through something that maybe you hadn't seen before or no one had experienced before, it's always great when you have people you can reach out to, kind of understand what your experience is, some of the things they're doing. So that sharing of information is definitely helpful. And there are a few things that, we're able to sort of take from other institutions and also maybe implement here through those connections.
Yeah, for sure. And just a plug for vendors in general, vendors like Remediant get to talk to CISOs all over the world all the time. And if you're not asking your vendors for connections with other CISOs that are maybe in the same industry or facing some of the same challenges, again, a plug for reaching out to your vendors and asking those questions, because we can often be helpful in that way. I'm kind of curious, what part did employee identity security and security controls play in this sort of modified InfoSec landscape that you created throughout the pandemic? And really, was there a change in the business's perspective on identity and how security fits in?
Oh, certainly. So identity, not to be cliche, really became the new perimeter, right? In this new norm, the only constant variable was the identity of our employees and knowledge of our internal environment. And so it became very critical to be able to correctly identify a user, authenticate them, and then authorize them with just the right level of access and permissions for their role. As we know, the perimeter became even more amorphous. Not only that, but now we're handling requests from devices and regions that maybe were not the norm. And in some instances, as I mentioned earlier, we're granting access to applications or resources that in the past were not necessarily accessed remotely. So identity security and the security controls, they remained a central aspect of the security program. And the business totally understood that. I don't think it became more clear than when you had just a huge, piece of your employees working remotely. It became very clear that this is something that's central and very important when it comes to security.
You brought a point I hadn't thought of before, actually, which is around the geo-locking, right? So whereas before you probably could have geo-locked it to just Summit County, right? And you probably would have caught, 95% of the traffic within Summit County. So did you see employees move out of Summit County and really have to think about your geo-blocking strategy a little bit differently because of that?
Oh, definitely. I mean, and then you also have physicians who travel, but you do have people if you have to work from home, they want to be with your family, so it has to be outside of the normal areas. Now, yes, we did see some of that. It may not necessarily be areas or regions that in the past we sort of blocked. But now we're getting traffic, which, it registers as a deviation, like, hey, all of a sudden I have this traffic coming from, say, Arizona, but there was some of that where new areas coming in and traffic coming from new regions.
Yeah, that's really fascinating. Really, that a lot of the old indicators you had to rethink, right? A lot of these inbuilt assumptions about where does the traffic originate and where does it terminate and what the applications to it provide really had to be rethought. One of the questions that just came up in the Q&A was actually around that topic. And the question was, I'm guessing there was a massive surge in VPN usage. It's probably a safe bet. Were there issues with performance, and did you have to add additional bandwidth?
Well, we did not have to add additional bandwidth. the good thing is I think the organization was fairly well prepared for having that sort of surge in remote work. The only thing we did was we paid more emphasis as far as what's going on that end, mainly around the end user experience and so forth. Now, in my old organization, definitely, we did have to look at adding additional licenses when it came to the VPN.
Mm-hmm. Yeah, but from a bandwidth perspective, your IT operations team had had enough bandwidth in place for that.
Definitely, yes.
Sounds like that makes sense. I'm kind of curious, actually, did you see a surge in support issues around VPN? I know that other organizations I've talked to, maybe they didn't have to upgrade the bandwidth, but they weren't ever. A lot of these folks, the employees that were now working remotely, had never. Maybe they had the VPN client installed, but never actually used it before, never had cause to use it. Did you see a surge maybe on the support side?
Oh, certainly. Yeah, and it stems from what you just mentioned. We had some people who maybe VPN usage was not something they did on a daily basis. And so it was more of training and then hand-holding and saying, okay, this is how you access your internal resources. This is how you fire up your VPN and so forth. But yes, there was an uptick as far as support calls for VPN.
Yeah, for sure. I imagine a lot of those folks are essential workers, right? So it's critical that they be able to get onto VPN, that they be able to access those resources, I imagine.
Definitely.
When it comes to essential workers, I imagine in an organization like Summa Health, you have a significant number of essential workers. I mean, yourself probably included. Did that present some challenges for you as you modeled out, how do I support them? All the things you mentioned at the top of the webinar around productivity and safety and everything else. Did you have to think about things maybe differently because you had so many essential workers?
Oh, yeah, you had to, right? Say, for example, something like provisioning. Now you had to maybe get a nurse coming from another region coming to work here. The turnaround on the provisioning, well, that's out of the window because they need that access right away.
Right away.
Exactly, And so, yes, there's some instances where maybe what was the norm in the past, we had to put that aside and say, for what we're facing, what you're looking, how best can we serve the patient? And in those instances, we did what was required, as much as possible securely, but just to make sure that the patient care was delivered in a timely manner.
Yeah, absolutely. Well, a great time to offer a shout out and a huge thank you to all the essential workers, yourself included, George, for the work that you're doing to keep all of us safe and healthy. So if you have nurses and doctors and respiratory therapists and folks like George that work on the back office side in your life, please extend your thanks and appreciation during this holiday period for all the great work that you guys are doing to keep America healthy.
Thank you, Paul.
Yeah. All right, back to more technical questions. Talking a little bit, kind of shifting a little bit about consumers, right, and about patients in your case. So consumer identity and consumer identity security certainly have been pretty hot topics, right, as more patient interventions move online. So the ability for patients like me to be able to be seen via telemedicine or other technology platforms. We've seen probably several years worth of innovation in the last 6 months. It feels like, anyway, to me as a patient. What are your predictions for how this evolves, both from a telemedicine perspective, but also from a patient security perspective?
Oh, yeah. So I think this keeps growing, and on-cue becomes very attractive to bad actors. So educating patients will be key. And then also coupled with good incident response plans for fast and also immediate notification in case of a breach. I think telehealth infrastructure will require more resiliency in design. And finally, the same way we do with our internal employees, we have to develop and put in place a way to be able to definitively identify patients. So essentially, when you have a patient that creates an account online, having that definitive knowledge that this is a patient that created that account. When they have an encounter with a caregiver, same definitive knowledge that this is the right patient, and to the patient that the caregiver that they're seeing is the right one. However, what I think the expectation is that this business vertical will keep growing. And strange enough, with COVID-19, telehealth has somehow seemed to be a common offering. But really, if you look at it, given the promise it holds, I say it is certainly going to be a disruptor. And we can certainly say that this is in the early phase of the digital health hype cycle. If you think of the other larger ecosystems with the wearables, with genomics, with some of these advances in healthcare, being able to offer that continuum of care to where you're not just seeing someone when they come in to see, or rather, you're not having a visit or an encounter with a caregiver when they're really sick, but you pretty much can have that continuum. You can see for maybe several days or weeks or even years their health pattern. I think it's definitely going to be a game changer once we have everything else sort of working in tandem with just what today we refer to as telehealth.
Yeah, and I welcome that day. So I mean, I grew up in a very rural part of Northern California, and I know that in your area of Ohio, you also have a lot of citizens that live in the rural areas, and the ability for telehealth is a life and safety issue, right? Because they don't need to make a multi-hour trip into Akron to be seen by a physician or whatever. So I think that I totally agree with you. I think there's a huge amount of promise there. I want to get back to the question you had raised around, or the point you had raised around identity proofing. So what do you see as evolving in there? I mean, I think hopefully anyway, gone are the days of if you know my social security number, then you are me. So what are you seeing that's evolving there in the identity proofing space?
We would have to come up with again unique identifiers, if I may call that, that would be able to identify the patient, and then on the physician side, the physician themselves. I think I read somewhere this article which sort of was showing what the future may look like, and leveraging maybe something like blockchain. Right. So
yeah.
I see a development of maybe those unique identifiers to where, whenever that, I don't want to call it a transaction, but wherever we have that sort of encounter, I'm not having to put all my information online, or I'm not having to have my PHI or PII, but something else that can be used to not only give me the right treatment I have, but also be able to definitively identify the patient.
Yeah, that makes total sense, and I think that we'll continue to see evolution there. As an aside, I work on a government panel called ATARC, and they're actually asking a lot of the same questions within the government space, right? Which is how do you do identity proofing for government employees? It's not an easy challenge to solve, and I think that we're going to see it solved in some ways we haven't even predicted yet. So I totally agree there. On the consumer identity side, it seems like phishing has stepped up a lot, not just for your employees, but also for the patients that you serve. What are you seeing, and how are you responding?
Oh yeah, certainly. So phishing has increased, but on the same token, I think employees are much more aware, and they do act as a good line of defense, right? Matter of fact, I like to say our employees are our strongest line of defense and not the weakest link. Now, they could be the most targeted, but certainly our strongest line of defense. And a lot of this has to do with collaboratively building a robust user awareness program, which includes maybe different delivery channels, whether that's newsletters, emails. You could use targeted training, or even mock phishing attacks. The other thing we do is we spend time analyzing the impact of the program and also trends that we are seeing. And this helps us to constantly evolve and make sure that we are definitely addressing any new areas of threats. And so a good example, we always made sure to train our users on home security. But now this has actually become even a more point of emphasis. I would say the overarching goal, what we aim for, and this is something that maybe has made a big difference, which is our approach, is that we strive to make real adaptive change, meaning we change the user behavior. And so we take the long-term approach to where it is not just an annual training, but a combination of different factors to be able to get to our end goal. being able to involve the end users, the employees, making sure they're part of the security program, because we say security is a shared responsibility. You can't just point and say it's an information security group. It's something shared. That helps to sort of move it to where it's part of our day-to-day work, and has been very helpful.
Yeah, George, I love the things you said there about employees being the strongest line of defense rather than the weakest link. And I think that the more security organizations that adopt that philosophy, the more, I won't even say compliance, the more partnership that they'll end up having with the employee base. And so I just love that perspective. I wanted to dig into something you mentioned there earlier, which is you think about employees and you think about their home security, and you help them think about sort of holistically their security situation. Maybe tell me a little bit more about what you've done there and kind of your philosophy around that.
Definitely. So the approach has been, so one thing that happened is, in a way, the corporate network got extended to the home network. And so knowing that, my take is the same due diligence we have in the corporate network should be the same due diligence we have in the home network. And so there are things you can do besides sort of educating your employees. It's asking questions like, okay, what are some of the maybe antiviruses solution that you run? I know there are vendors there who will give you corporate, and then they also give you home sort of iteration of the same antivirus. And so it's making that available to employees if need be. But more importantly, I think it's that education sort of reinforcing why it's important to be secure, why they're an attractive target, and then also their role in being able to protect the data and our patients.
Yeah, and sadly, I think that becomes increasingly, these employees become increasingly targets as we start to roll out the vaccines, right? And we start to think about, the bad actors out there that are trying to disrupt the vaccine distribution, which is going to be an enormous challenge, right, for the American healthcare system. And huge kudos and thanks to you and organizations like yours that are going to be doing the frontline work and getting those vaccines out there. We all look forward to that day when we've completed a mass vaccination effort. But just talking about employees a little bit, one of the questions that came in, I'll read it here for you. Did you consider supporting BYOD, or maybe you already did? Was this popular, and how did you enable security on those devices?
Oh, yes, certainly. Yes. So I think one of the approach, and this is something we had been thinking before, and when I say this, I mean also in my former organization, it's the fact that we wanted to get to a point to where it didn't really matter, say, for example, what device you're coming in with, or where you're coming in from, as long as we can do two things. We can identify who you say you are, and then authorize you to get to those resources with just the right permissions. And so as much as possible, that's what we strive for. We did have Citrix sort of an instance there. And so yes, BYOD, but we coming through Citrix instance, and then they'll be able to access the resources that they needed or required.
Yeah, well, I love the 2 points you highlighted there, because they fit exactly into the identity-centric security model, which is think about authentication and think about access, right? And how do you focus on those two things and making sure that those are done really well? And I think your point is that those can work really well in the BYOD world. They can work really well in the corporate network. You just have to think about them through that lens. So I think I love your perspective on that, George.
Thank you.
Let's see. One of the other questions that came up here was, what is your take on the responsibility of the health system in protecting the patient's electronic identities? And what's your perspective? And where do you think patients are with this? Where do you think their headset is, their mindset is, rather?
Well, I think being able to protect patients' data and identity is our license to operate. We have legal and regulatory requirements that actually mandate this. And not to mention, it's actually the right thing to do. And this also extends to being able to educate the patients and then working together to be able to protect their identities. So really, the health system and any institution there should be doing all that is possible to ensure security of these identities. And when it comes to patients' perception, there's this inherent trust in caregivers, which extends to health systems and institutions. The trust that the data that's requested is for their own good, that it will be accessed by just those with a need to know, and most importantly, it's going to be secured. So again, the more reason why health systems really have to have the right controls in place not to break this trust. So I would say it's one of the core sort of responsibility of a health system is protecting that identity.
Yeah, I never thought about that before, but you're totally right. I, as a patient, the trust that I put into my physician, my nurse, my physician's assistant, all the people that make up my healthcare team, the trust I put into them extends to the data that I'm giving to that organization as well. And it definitely puts a burden upon you and organizations like yours.
Sure.
To keep that safe. That is different than the trust I put into some e-commerce provider, right? Because I don't trust them nearly as much as I trust my physician and the team.
Agreed.
Yeah. Well, we talked a lot about all the work that you're doing. How are you keeping your staff from getting burned out now that we all live at work? Though you're actually at work, I have to point out.
Yes, it would be a really fancy home office, right?
Yeah.
Certainly. I think emotional intelligence is key. Knowing your employees, you can tell when someone maybe is struggling with maybe something or having a bad day. And then I think to an extent, video conferencing and all these collaboration tools, they've been really useful. What I do is, and I think what I mention is, all I say is, we might be far or in different areas, but at the end of the day, I'm somehow letting you or you're letting me into your space. I'm able to see, say, for example, you at the back there, I can see your nice Christmas tree, your office. If we didn't have, or we were not in this scenario, that's something maybe I would never have been able to see. But it's having that emotional intelligence, empathy, really knowing your people, and then at the end of the day, understanding these are human beings. There are a lot of factors that might go into when you see someone. You don't know what's going on in their life, their personal life. They have everything appended, maybe kids learning from home, additional responsibility, and so forth. So having that understanding is key. What I've always vouched for, and this is maybe a way that I sort of tend to manage, I'm more of an output than input person, meaning I don't care how many hours you come in the office or how long you're in the office, I just want to know what you're going to give at the end of the day. So offering that flexibility, because there's some people who maybe during the day, they're just not going to be able to do work. But once you get to maybe 9 o'clock, hey, they might be able to get 3-4 hours to knock off what needs to be done. I think that's key, giving them that flexibility and working around their schedule, because these are totally different times that no one had seen or really thought of.
Yeah, totally. Unprecedented is a word that gets used a lot these days, but it actually fits.
Exactly.
Actually, I would love to talk a little bit more about emotional intelligence, the thing you mentioned at the beginning of your answer there. I totally agree, by the way. I think emotional intelligence, especially within the informatics and technology world, is often goes underappreciated. What is it that brought you, in your own experience, to emotional intelligence as a key part of how you can be an effective leader?
Well, because you're dealing with people, and a key piece of that emotional intelligence actually is self-awareness. It's knowing your blind spot, which, again, the higher up you go, the more you're in leadership position. If you're not careful, those blind spots get bigger and bigger and bigger. And then it's also, again, knowing these human beings. Once you have that self-awareness, now you're able to be able to put yourself in their situation. We take it for granted. I can come have this really luxurious, not luxurious, but I have a big office. It's comfortable. I have, it's not the case for everyone. There's some people working from home. The home situation might be just not what mine is. So having emotional intelligence helps you be able to connect with others. It also helps you to be able to know when something is off. And I think biggest of all, it creates that trust. They just don't see you as a manager. They see you're relatable. They can talk to you. And in the end, I always say, your team, you're only as good as the weakest person in your team, or in your, the weakest link in your chain. And so if you have that solid team and it's working well, it's functioning as it should, in the end, makes you look good and you're able to achieve your objectives. But emotional intelligence, again, in the age of machines, computers, AI, I think that's something that's really missing, and it's helpful.
Yeah, I totally agree. And having had the excellent opportunity to work with several of your teams, I have to say that it works for your teams, right? So the folks in your organizations that I've got the chance to work with are, I find, to be emotionally invested in their work. They come to work happy. I think that there's a deep appreciation. They feel that deep appreciation for that you have for them bringing their whole self to work. So I think whatever you're doing is working really well, George. And I think that a focus on emotional intelligence is a critical part of that.
Definitely.
Yeah. Any suggested reading or research or anything that you have found around emotional intelligence as a technology leader that's been really effective for you that you would recommend to others?
Several books on servant leadership. I think that's key. Just understanding yourself as a leader. What is your role? I always say I'm there to sort of, if you want to call it, set this parameter and say, okay, these are the borders. My team is there doing whatever, just going out, getting what needs to get done, and I'm getting the hurdles off so that they can be able to accomplish what they're trying to do. Because if you really think about it, if you have a team of however many, 8, 10, 15, there's no way you as a leader and all the experience you have will match those 8, 15 people and the lifetime they've had in the industry.
Right.
Exactly. And so if you can leverage their expertise, if you can leverage their knowledge, it would just shock you some of the things that you might be able to achieve. And I think human aspect, human element, when we design, when we do projects, when we have implementations, one of the things we do is consider that human aspect of it. Whoever is using it, how is this going to affect their workflows? How is it changing? Because you may tweak something very small, and then it becomes such a huge hurdle because someone is just doing something a certain way. And think of it, especially physicians, right? Physicians, if you think about it, you're going through medical school, you're going through all your schooling, you do your residency, you start working. Things you do in a very specific order. So they like that sort of, this is the way it's always been done, and this is how I should be doing it. So when you change something, you have to consider that. How is that going to affect them? And was there proper communication beforehand and so forth? So it's always not forgetting that human aspect. We're protecting at the end of the day mainly humans. Keeping an eye on that makes life much easier for me.
Yeah, well, and that's literally true in your case. They're protecting the health of humans in multiple different elements. So I love that perspective. George, we have covered a lot of ground today. I love it. We started talking about COVID-19, but we talked about system health and how do you protect the information security of our organization, and we finished talking about how do you protect the humans in it. And for me, that's the perfect punctuation on our talk today. So, George, I wanted to say my extreme and deep thank you for making the time for us today. I always enjoy our chats, and this has been yet another really enjoyable chat for me.
Thank you, Paul.
All right, George. Well, be well. Thank you again for the great work you're doing for the folks there in Summit County through the work you're doing at Summa Health, and I'm sure we'll talk again soon.
Thank you.
All right. Be well.
All right. Bye-bye.